Welcome to another episode from the Veterinary Medicine Digest. Today, we're delving into a fascinating area of veterinary surgery that could revolutionize how we fix certain bone fractures in our beloved canine companions. We're talking about a novel composite material called AdhFix and its potential as an alternative to traditional pins and plates for stabilizing humeral condylar fractures. Have you ever considered the complexity of repairing a broken bone in a dog? It's not always as straightforward as it seems, especially when dealing with specific types of fractures, like those affecting the humeral condyle. These are commonly encountered in veterinary surgery, with Cocker Spaniels and French Bulldogs being among the most commonly affected breeds. Unicondylar fractures most often impact the lateral part of the humeral condyle. Typically, these fractures are repaired using a transcondylar screw placed in a lag fashion to achieve anatomical reconstruction of the joint surface. This is then combined with adjunct fixation of the epicondylar portion. So why is this adjunct fixation so important? Well, it provides both rotational stability and helps reduce the cyclic forces on the transcondylar screw. This is particularly critical in cases where humeral intracondylar fissuring is the suspected underlying cause, and the intracondylar part of the fracture isn't expected to heal normally, meaning the implants will likely experience mechanical strain throughout the dog's life. Now, the benefit of using an epicondylar plate for adjunctive fixation over a Kirschner wire, often called a K-wire, has been demonstrated in both ex vivo and in vivo settings. But there's a significant challenge to the plating. The topography of the lateral epicondyle is complex, making accurate conjuring of the plates in this region time-consuming. Poorly contoured plates can lead to unstable fixation, displacement of the fragment, and even loss of load sharing, which means the implant bears more stress. There's also the risk of screws breaching the joint surface, causing articular cartilage damage, or penetrating the supratrochlear foramen, which can inhibit normal elbow range of motion and cause ongoing lameness. This is where advanced research in novel composite materials presents exciting new possibilities. One innovative approach is the AdhFix concept, which involves a high-energy visible light-cured fixator plate construct in a customized fashion to fit the specific anatomical site and morphology of the fracture. Think about the implications for adaptability, a material that can be custom formed on the spot for patients of vastly different sizes and bone shapes. This adaptable feature of the AdhFix plate is of inherent interest in the veterinary field, where bone size and shape can vary considerably between patients. Earlier studies have already shown the great potential for AdhFix for fractures, and the material platform has compelling safety evidence from biological safety studies and animal trials. So the objective of this particular ex vivo study was to compare adjunctive epicondylar fixation using AdhFix secured around bone screws with that provided by K-wires or traditional bone plate and screws in the lateral humeral condyle fracture model. Essentially, they wanted to see how well AdhFix stacked up against the current standard methods as an adjunctive stabilizer. Now let's move on to what the researchers found in their study, which involve cadaveric biomechanical assessment using paired humeri from skeletally mature dogs. The results are quite compelling and offer some exciting insights. In pairwise comparison, the yield load, which is the point where the fixation starts to deform plastically, was significantly higher for the AdhFix group compared to the pin or the K-wire group. This means the AdhFix group could withstand more forces before starting to permanently deform than the K-wire. However, when comparing the AdhFix to the plate group, no statistical significance was seen in the comparison for yield load. So, for that critical point where the fixation starts to give, AdhFix performs just as well as plates. Interestingly, the ultimate load reach during the compression test, the metal plate had higher load values than AdhFix, with a p-value of 0.004 indicating a statistically significant difference. The plate group endured loads between 2,186 and 3,635 newtons, while the AdhFix group endured 1,337 to 2,237 newtons. But it's critical to remember that these ultimate loads are considerably higher than the yield points, which are arguably more relevant from a clinical perspective. Regarding construct stiffness, the pairwise comparison did not show a significant difference between any of the paired groups. This suggests that the initial load-bearing ability is quite similar across the different adjunct fixations. When looking at how the constructs failed, all constructs repaired using pins or plates failed as a result of the pin or plate deforming. For AdhFix, a total of 13 constructs failed due to fracture of the AdhFix composite over a screw head, and 2 failed due to fracture of the AdhFix composite between the screw heads. Additionally, 3 AdhFix constructs failed because the bone of the capitulum around the transcondylar screw split prior to implant construct failure. So, what does all this mean for the future of veterinary surgery? This study demonstrated the mechanical superiority of AdhFix adjunct fixation over fixation with a K-wire, and its comparability to plate fixation for yield load when used in combination with a transcondylar screw in a lateral humeral condylar fracture model. This aligns with previous research that showed epicondylar plate fixation was superior to K-wires. The lack of difference in stiffness and maximum load between AdhFix and K-wires suggests that the transcondylar screw is the main load-bearing implant at high loads. One of the key takeaways from the discussion is the potential clinical benefit of AdhFix. As we mentioned earlier, the lateral aspect of the distal canine humerus is a difficult region to contour plates to. Non-locking plates require accurate contouring to generate bone plate friction and stable fixation. While locking plates mitigate some of these issues, their fixed angle nature can direct screws towards the articular surface or supratrochlear foramen. AdhFix offers significant advantages because of its custom nature. It allows for reduced inventory for clinics and is adaptable for any patient size. A major clinical benefit is the adaptability to place screws in any position to maximize available bone stock and account for individual variations in bones with challenging anatomy. This is a significant advantage over current commercially available fixed angle locking plate systems. Beyond the immediate mechanical benefits, the researchers highlighted other potential advantages of using hydroxy apatite-based composites like AdhFix. These could include benefits regarding pain experienced by patients when exposed to cold temperatures, reduced stress shielding pain experienced in patients when exposed to cold weathers, reducing stress shielding due to the composite's modulus of elasticity being closer to that of bone, and a lack of soft tissue adherence. Previous in vivo testing in rodents has shown that AdhFix could successfully stabilize and maintain alignment of transverse femoral osteotomies with no soft tissue adhesions witnessed, unlike metal plate controls. Histology demonstrated no adverse effects, and micro-CT confirmed successful bone healing. An additional benefit is that the composite fixation is radiolucent enough to not obscure the fracture site, allowing for clearer evaluation of fracture healing in clinical cases. Of course, like any good scientific study, there were limitations. In this study, mechanical testing was restricted to acute load failure. While informative for initial mechanical testing in a canine cadaver model, cyclic loading using physiological loads would be better for mimicking the clinical setting, should be evaluated in future studies, and I believe this group is actually working on that. The constructs were also only tested in a single direction, which doesn't fully evaluate the complex real-world forces experienced in the elbow joint. Additionally, the inflicted osteotomy was standardized and does not perfectly mimic a clinical fracture, though this was consistent across all subjects. The researchers also note that specimens were tested beyond what would be deemed clinically acceptable failure, which is a 10 millimeter displacement, but this standard was used for comparisons with other studies. They emphasize that the yield point is the most relevant value when assessing from a clinical perspective, as any displacement of an articular fracture would be deemed a failure. As a note, in this study, the yield point was significantly higher for the AdhFix group compared to the PIN group, and there was no statistical difference between the AdhFix group and the plate group. What does all this mean for you, whether you're a veterinary professional or just a curious pet owner? This study represents the initial investigation into the mechanical properties of this novel composite for adjunctive fracture fixation from the lateral part of the canine humeral condyle. It's a significant step in validating a new technology that could simplify fracture repair, potentially improve patient outcomes by offering more flexible and less invasive options, and certainly provide more adaptability for surgeons. The ability to custom fit a strong, biocompatible material on the spot is a game changer for complex anatomies. While these results are encouraging and build on a previous reported safety data, further testing will be carried out prior to the product becoming commercially available. This could include more extensive cyclic loading tests to simulate real-life stresses and in vivo studies to observe long-term healing and patient comfort in dogs and cats. Keep an eye out for AdhFix. It might just become a common name in the operating room in the future. Thank you for listening to the Veterinary Medicine Digest. The title and link for the reference paper is in the video description, and remember to test your knowledge by answering the questions that are also in the description, and as always, keep your minds inspired, hearts light, and tails wagging.